I heard my colleague talk about the ability of this budget to allow for the repeal of the Affordable Care Act, the 5th anniversary we all celebrated this past month. The budget allows for the repeal, but it's interesting. It doesn't repeal the revenues. It takes the revenues that we put in place, but repeals the benefits. A little bit of irony in that. And it would add to the deficit. That's clear. And I'll give you the reason why. But you use magic wands so you don't have to worry about that. So why would the repeal of the Affordable Care Act add to the deficit? Because the Affordable Care Act has helped us reduce health care spending in this country, the growth rate of health care spending. You don't have to take my word for it. Congressional Budget Office said that federal health care spending between 2011 and 2020 will be $600 billion less than they previously estimated. The Affordable Care Act is bringing down health care costs. It's bringing down the federal deficit. The federal deficit through 2025 was adjusted down by $400 billion since the January projection. It's saving health care consumers. Those of us who buy our insurance, or use our health care system, it is now projected that because of the savings between 2010 and 2014, the years of the Affordable Care Act, the average family is saving $1,800 a year. These are results from the Affordable Care Act that this budget will allow us to repeal. Look at the number of uninsured. It's been reduced by 16.4 million. We've reduced the uninsured rate by 35%. We've increased the number of individuals enrolled in Medicaid and CHIP. The increased rate is at 17.5%. In Maryland, that's 300,000 more in those programs. We've improved insurance coverage. We now have much better coverage, covering preventive care, screening tests, no caps, no annual caps, no lifetime caps. You can keep your children on your policy to age 26. You get value for your premium. If not, the insurance company has to rebate the excess charges. And since 2011, $9 billion have been rebated to healthcare consumers. And we've ended pre-existing conditions. And if you don't think that makes a difference, let me just tell you the story about two Marylanders, Jack and Akeisha, who came to my office last year for help in navigating the Maryland health marketplace. In August of 2014, they were able to apply for insurance through a special enrollment period. But while waiting to hear back about the status of their application, Jack suffered an injury. If this had happened in 1995 or 2005, this might have prevented Jack and Akeisha from obtaining coverage they so badly needed. But thanks to the Affordable Care Act, they got coverage. And it covered everything. There was no exclusions. Coverage is now affordable. 71% of the people who got insurance through the Maryland Exchange got premium tax credits, so they could afford their coverage. And in Maryland, we've reduced our uninsured rate from 12.3% in 2013 to 7.8% in 2015. We all benefit from that, not just the people who have insurance. As you know, our premiums cover the cost of people who don't have insurance. We don't have to pay for those who now have insurance. So it's in everyone's. Less people using emergency rooms. We are making the system more affordable. And for our seniors, the prescription drug, closing the donut hole, 8.2 million seniors have saved $11.5 billion. In Maryland, the average saving for a Medicare beneficiary is $1,400. No co-payments under the Medicare system. The solvency of the Medicare system is stronger today. But I think the most exciting thing about the Affordable Care Act is the way that we're changing the delivery system in this country. Take a look at it. On hospital-acquired conditions, deaths as a result have reduced 17% since 2010. These are circumstances such as ulcers or infections or traumas or falls. That's reduced dramatically as a result of the Affordable Care Act. And Medicare hospital readmissions are down. From 2012 to 2013, 150,000 less readmissions. So the Affordable Care Act is working. All these facts make one point abundantly clear. The Affordable Care Act has transformed our country for the better. It has brought quality, affordable care to millions of Americans. It has expanded coverage for young people, minorities, and working families. In a span of only 5 years, it has saved seniors billions of dollars over their prescriptions, strengthened our safety net, and has recovered a record-breaking $19.2 billion in taxpayer funds from those committing health care fraud. And the Affordable Care Act will continue to save our country billions of dollars into the future. And the budget that we're acting upon would repeal that progress. And there's other aspects to the health care that's affected by the budget, including the attempt to turn Medicaid into a voucher program. Medicaid, our most vulnerable, our seniors and their long-term care needs. I would hope we wouldn't want to do that, but the budget allows that. And the budget just doesn't add up. It creates deficits far beyond what to do. We use magic wands to deal with it.